Doctor, my X-ray doesn't look that bad. So why is the pain so severe? Why does my knee throb at night even when I am lying perfectly still? If you ask these questions, you're not imagining it. And no, it's not all in your head. The standard explanation is that it is bone on bone friction. But friction only happens when you move. If you have pain at rest or burning pain, we are dealing with something else entirely. We are dealing with biology and nerves. We need to stop looking at the knee as a mechanical hinge. It is a sensory organ. Today, I'm going to show you the 3 biological reasons your nerves are screaming and show you the evidence that explains why standard painkillers often fail. First, we have the chemical fire. In an arthritic knee, the joint fluid changes. It becomes acidic. It fills with inflammatory chemicals called cytokines, and specifically interleukin 1 beta and tumor necrosis factor alpha or TNF alpha. Research by Wren and Thorns has shown that these chemicals literally bathe your nerve endings. Think of it like a sunburn. When you have a sunburn, even a light feather touch hurts. That is called sensitization. Inside your knee, these chemicals lower the firing threshold of your nerves. The nerves start sending pain signals to your brain even when you're not doing anything damaging. You aren't grinding bone, you are bathing nerves in acid. Second is the deep gnawing ache, the toothache in the knee. This comes from inside the bone itself. We have known this since 1972 thanks to the foundational work of Arnoldi. He proved that in osteoarthritic knees, blood flows into the bone marrow but gets stuck trying to flow out. This causes pressure inside the bone called intraosseous hypertension. Think of it as a migraine inside your kneecap or bone angina. This pressure builds up when you are still, which is exactly why so many of you suffer from night pain that keeps you awake. And finally, the third mechanism is the invasion. Healthy cartilage has got no nerves. You could cut it and feel nothing. But when cartilage is damaged, the body tries to heal it by sending in new blood vessels. A landmark study by Walsh in 2010 showed something critical. New nerves grow alongside these new blood vessels. They invade the cartilage where they should not be. So now you have raw nerve endings growing into the cracks of your cartilage. Every step you take crushes these new nerves. So why does this matter? Because if your pain is caused by chemical sensitization, bone pressure and nerve invasion, simply scraping the cartilage or taking a painkiller won't fix it. This is where Orthobiologics and my PRASAD protocol come in. We are not just looking for mechanical gaps. 1. We use anti-inflammatory signals to neutralize that chemical soup, calming the sensitization. 2. We target the subchondral bone to relieve that migraine pressure. And 3. We modulate the environment to stop that pathological nerve invasion. If you have night pain or burning pain, don't let anyone tell you that there is nothing wrong just because the X-ray looks normal or okay. The pathology is invisible to X-rays, but it is very real to biology. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Centre. Let's treat the cause and not just the symptoms. In the next video, I'll be talking about PRP, specifically a formulation called LP-PRP or leukocyte-poor PRP. This is the foundation of orthobiologics. So next video, LP-PRP. If you have any questions, drop a comment below. I will answer every question personally.